In this video, we will discuss in details anxiety disorder, causes, symptoms, and treatment. Anxiety is a normal reaction to stress, and it is a part of life. However, when anxiety becomes excessive and starts interfering with daily activities, it becomes a disorder. Anxiety disorders involve more than temporary worry or fear. It is estimated that 40 million adults in the United States are affected by anxiety disorders. Kindly click the subscribe button below. Please, it means a lot to us if you click the subscribe button. Thanks in advance for supporting diet2wellness.com. Also important, check the description of this video below. We have included important reference materials and related links on this subject matter. Now let's continue. At the moment, let us discuss the types, causes, symptoms, and treatments of anxiety. What are the types of anxiety disorders? There are several types of anxiety disorders, including generalized anxiety disorder, panic disorder, social anxiety disorder, and various phobia-related disorders. What is generalized anxiety disorder? Generalized anxiety disorder, GAD, usually involves a persistent feeling of anxiety or dread, which can interfere with daily life. People living with GAD experience frequent anxiety for months, if not years. Symptoms of GAD include feeling restless, wound up, or on edge, being easily fatigued, having difficulty concentrating, being irritable, having headaches, muscle aches, stomach aches, or unexplained pains, difficulty controlling feelings of worry, and having sleep problems, such as difficulty falling or staying asleep. What is panic disorder? People with panic disorder have frequent and unexpected panic attacks. Panic attacks are sudden periods of intense fear, discomfort, or sense of losing control even when there is no clear danger or trigger. During a panic attack, a person may experience pounding or racing heart, sweating, trembling or tingling, chest pain, feelings of impending doom, and feelings of being out of control. Panic attacks can occur as frequently as several times a day or as rarely as a few times a year. What is social anxiety disorder? Social anxiety disorder is an intense, persistent fear of being watched and judged by others. For people with social anxiety disorder, the fear of social situations may feel so intense that it seems beyond their control. For some people, this fear may get in the way of going to work, attending school, or doing everyday things. People with social anxiety disorder may experience blushing, sweating, or trembling, pounding or racing heart, stomach aches, rigid body posture, or speaking with an overly soft voice, difficulty making eye contact or being around people they don't know, and feelings of self-consciousness or fear that people will judge them negatively. What are some phobia-related disorders? A phobia is an intense fear of or aversion to specific objects or situations. People with a phobia may have an irrational or excessive worry about encountering the feared object or situation, take active steps to avoid the feared object or situation, experience immediate intense anxiety upon encountering the feared object or situation, and endure unavoidable objects and situations with intense anxiety. What is agoraphobia disorder? Agoraphobia is a type of anxiety disorder characterized by an excessive and irrational fear of certain situations. People with agoraphobia experience intense fear and anxiety in two or more of the following situations: using public transportation, being in open or enclosed spaces, standing in line or being in a crowd, and being outside of the home alone. Due to their fear of experiencing panic-like reactions or other embarrassing symptoms, individuals with agoraphobia may avoid these situations altogether. In severe cases, agoraphobia can lead to complete houseboundness. What causes of anxiety? Anxiety disorders are caused by a combination of factors, including genetics, brain chemistry, personality, and life events. Studies suggest that anxiety disorders run in families. Certain brain chemicals called neurotransmitters play a role in anxiety, and imbalances in these chemicals can lead to anxiety disorders. Personality also plays a role in anxiety, as people who are shy or withdrawn may be more prone to anxiety. Life events such as trauma, abuse, or a major illness can also trigger anxiety disorders. What are the symptoms of anxiety? The symptoms of anxiety vary depending on the type of anxiety disorder. Common symptoms include excessive worry, restlessness, difficulty concentrating, irritability, muscle tension, and sleep disturbance. Panic attacks are a hallmark symptom of panic disorder and may include sweating, trembling, shaking, palpitations, shortness of breath, feelings of choking, chest pain, nausea, dizziness, and fear of losing control or dying. Social anxiety disorder is characterized by intense fear or anxiety in social situations, including fear of being judged, scrutinized, or embarrassed. Symptoms include blushing, sweating, trembling, rapid heartbeat, muscle tension, nausea.
Kindly click the subscribe button below. Please, it means a lot to us if you click the subscribe button. Thanks in advance for supporting diet2wellness.com. Also important, check the description of this video below. We have included important reference materials and related links on this subject matter. Now let's continue.
How to treat anxiety. Fortunately, there are effective treatments available for anxiety disorders. Treatment can involve therapy, medication, or a combination of both. Let us discuss each of them. 1. Psychotherapy. Therapy can be an effective treatment for anxiety disorders. Cognitive behavioral therapy, CBT, is one of the most commonly used therapies for anxiety disorders. CBT helps individuals identify and change negative thought patterns and behaviors that contribute to their anxiety. In addition, exposure therapy can be helpful for individuals with phobias, as it involves gradually exposing the individual to the object or situation they fear in a controlled and safe environment. 2. Medication. Medications can be used to help manage symptoms of anxiety. Antidepressants, such as selective serotonin reuptake inhibitors, SSRIs, and serotonin norepinephrine reuptake inhibitors, SNRIs, can be helpful for some individuals with anxiety disorders. Benzodiazepines can also be used to treat anxiety, but they have a higher risk of addiction and withdrawal symptoms. 3. Lifestyle changes. Making certain lifestyle changes can also help manage symptoms of anxiety. Exercise, healthy eating, and stress management techniques such as mindfulness and meditation can be helpful for individuals with anxiety disorders. Please note, if you feel like you're worrying too much and it's interfering with your work, relationships, or other parts of your life, it is essential to seek professional help. See your doctor or mental health provider before your anxiety gets worse. Early treatment can make it easier to manage anxiety symptoms, improve your quality of life, and reduce the risk of developing other mental health problems. In conclusion, anxiety disorders can have a significant impact on an individual's life. They can interfere with daily activities, relationships, and overall well-being. Fortunately, effective treatments are available, including therapy, medication, and lifestyle changes. If you or someone you know is struggling with anxiety, it's important to seek help from a mental health professional. With the right treatment and support, individuals with anxiety disorders can learn to manage their symptoms and lead fulfilling lives. Thanks for watching. Please subscribe, click the subscribe button below.